Hi, and welcome to A Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I'll be diving deeper into the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. Today, I'm happy to be talking more about exercise, daily fitness, and how to stay active and vital. I'll also be talking about how to get back to health if you've suffered an injury. I'm joined today by Dr. Mark Klion, who is a board-certified orthopedic surgeon with specialty training in sports medicine. He is the director of orthopedics at St. Barnabas Hospital in the Bronx, New York, a trauma center, and has specializations in arthroscopic surgery and reconstructive knee and shoulder surgery. Dr. Klion is a private practitioner in New York City and a clinical instructor at the Mount Sinai School of Medicine and attending at Lenox Hill Hospital. He is also an active educator for the Mount Sinai Medical School and Department of Orthopedic Surgery. Dr. Klion performs the newest techniques for knee, shoulder, and hip arthroscopy. He also has extensive experience in fracture care and management. What's more impressive, Dr. Klion makes time for his own endurance sports. He himself has participated in 11 Ironman triathlons and completed 15 marathons, in addition to many ultra-distance running and biking races. He serves as the medical director for the New York City Triathlon, and he has published numerous articles on sports medicine issues. He's appeared on regional and national radio and television programs, and he's active in the triathlon and endurance community, providing lectures about sports medicine-related issues. Dr. Klion co-authored a book entitled Triathlon Anatomy in 2012, along with Troy Jacobson, a world-renowned triathlon coach. This book helps any triathlete maximize strength, power, speed, and endurance while preventing injury. You can find more about that at humankinetics.com. I can let Dr. Klion speak about that. And finally, I will say that he also created a DVD home rehabilitation series entitled Bodyworks MD with a fellow physician, Dr. James Capozzi. All that said, I'm going to turn things over to Mark and also say I'm really grateful to have you here with me this evening.
Thank you. It's a pleasure to be here. It's a long intro and it's a lifetime of work, which amazes me that I've actually done all of that stuff. But certainly, being an orthopedic surgeon, I have somewhat lived and I'm living with injuries these days. So when I have patients that come to my office, I certainly walk the walk and talk the talk. So I think I bring a unique perspective on how to manage patients' injuries and their expectations of what they can and cannot do. So it's a pleasure. It's a pleasure to talk to you tonight.
Thank you. And that's exactly why I'm excited to get your perspective on all of that, bone and joint health, and talking about fitness, aging, injury, and I think even so much more. So again, thank you for being here. Thank you for bearing with me through the intro there.
Anytime.
Yeah. It was a long one. And it's important for listeners to know that background. It's all very relevant. I'm actually already curious about the injuries you mentioned, but one thing at a time. I think I'll start with my first question about how you got this nickname. I know that some call you Bone Crusher. It's probably pretty obvious as an orthopedic surgeon, but what do you think about that nickname?
That was in the early days of my career. It was actually in another lifetime and maybe another 6 inches in height and another 40 pounds, and I'd be an ice hockey player. But that was an ice hockey team that I was part of that we called the Bone Crushers. It was actually made up of a bunch of other orthopedic surgeons. So it kind of stuck with me and it's still there. But one of my avid passions is actually playing ice hockey. So I'm not Canadian, but it's
okay. That's okay. Great sport. I had no idea. Actually, I'm glad I asked that then. That's really funny. I thought it was related to orthopedics.
Yeah, it's somewhat related.
Somewhat as a team. That's pretty cool. That said, how did you end up pursuing orthopedic surgery?
Well, I have a father who's a physician. He's not an orthopedic surgeon. He is actually a gastroenterologist. So really an internist who specializes in liver disease. I have a sister who's 2.5 years older than me, who is also a physician. The interesting thing, I guess, was that I got sucked into a vacuum. Didn't really know anything else, but knew I loved science. So I think that was the path that I pursued. And, the grass is always greener on the other side. And everybody would say, well, I could do this or I could do that. I've been very happy and very fortunate, to be an orthopedic surgeon and follow a passion, which is now really coupled well with my sporting endeavors. So I never wanted to be an internist. I never wanted to be an infectious disease doc like my sister, but orthopedics seemed to be that one specialty that kind of, it sparked my interest and I like doing things. And that's why orthopedics is such a great field to be in.
Yeah, that's interesting. It's very, very hands-on, clearly.
Very much so.
And so obviously that's your passion and the sports too. So I mentioned it a bit in my intro, but you are an endurance athlete. You participated in 11 triathlons. And how do you manage to combine those two passions, like a, very probably intense medical career with your passion for the endurance sports?
Yeah, I think obviously there are what people might call a type A personality. I don't think I'm that extreme, although when my wife characterizes me and I say, I think my son said, gee, I can't believe, Dad, you work out that much. And I then put it into perspective and go, I don't really work out that much. And my wife really has to correct me instantaneously and say, no. You are at the one extreme of the world. You've got one life to live. One of my older partners used to say, life is not a dress rehearsal. So you got one chance to make it. And, I figured what better way to do it? I feel healthy, except when I get injured, God forbid. But I'm up early, up late, try and maximize my sleep, which I know you're a proponent and you've talked about. And I realize when I do sleep well that I am a much happier person. But, you just got to do what you need to do.
That's true. It sounds like it comes naturally to you. The physical fitness is important to you, but I find that very inspiring. That's why I love to talk to endurance athletes and people who, it's just part of your makeup. It must be in every cell in your body. I feel that I'm physically active, but it pales in comparison to that level of athletics, we'll call it that. So I just find it very inspiring.
Yeah, I've definitely, I started in triathlons on a dare. I was always athletic in high school and in college, but going through medical school, I was dared by a fellow physician to do a triathlon. And it was really at the beginning stages, probably, the early 90s, late 80s that I was challenged to do one. And I realized that I'm a good runner, a good cyclist, I'm an okay swimmer, but when you put them all together, it's a formula that just, it felt right. And from there, I met our fellow friend, Troy Jacobson, world-class athlete. He trained me throughout a good portion of it. We were involved in a multitude of projects. And now I've really kind of gone almost the next level of quantum leap in doing, ultra endurance marathons. So I completed a 100-miler this spring, which was an emotional, spiritual experience, and really have kind of globbed onto it that's kind of the next level of internal enhancement that is really kind of tickled my fancy.
That's impressive. I didn't realize that. And I think that that's a subject for a different podcast. Honestly, the mental fortitude, just what it takes to do something like that. Right?
I agree with you. I think it's almost anything, though. It's, the initiation of exercise. Our mind is our greatest barrier completely to accomplishing any task. And I think once you start to break down those barriers and you're able to push and notice success, that it just, it can leapfrog you to the next level, or you could be very pleasantly happy where you are. But I think for someone who likes the endurance world, it's a great community to be part of. And it's nice to be around those people who enjoy the same thing.
Yeah, you just touched on a few. It wasn't necessarily my next question. However, that community aspect, I think for listeners, what I really intend to do is inspire and empower people, Mark. And you just hit on two very important points, the community aspect of it and just doing what you love. Has to be that aspect. Correct.
Yeah. 100%. And I think initially the triathlon community was very welcoming. It was open. You could talk to, the pros, and they were willing to give you advice. I think, every sport goes through certain evolutions. And I think, to a certain extent, maybe 10 or 15 years ago, maybe 10 years ago, triathlons kind of peaked. And then there was a whole other variety of sports that came on the scene where, the entrance into a triathlon is not a cheap endeavor. From getting to a pool,
Right.
having a nice bike, running's the easiest thing in the world because all you really need is a pair of sneakers. So I think it did crescendo, but then, there are the Spartan races, there's CrossFit, there's a variety of other things that are out there. And certainly what I see now with more mature athletes is that trail running has really become a cult almost. It's less abusive on the body. People tend to go a lot slower, which is fine by me, but we push the envelope in time. So yeah, the community really makes everything. You have to find simpatico with other people. That's for sure.
Yeah, absolutely. Everything you're saying is triggering other thoughts for me. I had this conversation just this week with my brother. He is in his early 60s. He's an avid runner. He teaches cross country. Pretty amazing. And I'm saying to him, and I'm just going to say I'm significantly younger, but I have knee issues. So we're going to talk about how to train and avoid injuries. And I would like to get back to running. And as we age, that's a real concern to people, preserving our joints. So do you have any principles to follow to avoid the wear and tear, particularly on the joints?
Sure. I mean, I think first and foremost, a lot of this is genetics. So, you can be an absolute physical specimen, but if mom and dad gave you a bad set of genes, you're really going to have to deal with that. And that's going to be somewhat of a problem. I think like a lot of things that we're learning about, bone metabolism, osteoporosis, peak bone mass is about the age of 35, and we progressively lose bone mass going forward. Well, that's similar to muscle mass. About 35 years old is the peak point of your muscular, not development, but muscular size and strength. And we start to lose that. And we certainly know that the muscles are kind of the shock absorbers of our joints. And if they're weakened, more force gets imparted to our joints, which then can see more stress and ultimately break down. So I think, first and foremost, if you're going to want to be active, you need to do strength training. And the basis of strength training emanates all from your core being your lower back, your stomach, your hips. That's really the stabilizer of our body. And it's really the power generator of our body. So, people don't love to do core exercises. They hurt, they're uncomfortable, but I think there's something that will really help sustain your ability to do impact loading activities like running, like playing tennis, and doing those things. So I think strength training is in essence a key element of all of this. Is that something that we lose sight of? Everybody goes to the gym. Hey, let me do my bench press. Let me do my push-ups. But they forget about their lower extremity and their core. And to me, that's essential. And I'm going to be 60 comes January. And now, probably 3 to 4 days a week, I am strength training. Now, not heavy weights because you get hurt doing that sometimes, but light weights, more repetitions.
Right.
And I do that throughout the whole year. I don't stop doing that. And I think it's really helped.
That's fabulous. Thank you. But one of my questions you already answered, but I'm going to reiterate is tips or recommendations on getting the most bang for your buck when you don't have a lot of time, but like which exercise do you focus on? And this comes up repeatedly. So that strength training, but particularly the core. And I don't know if this is correct, but like at a minimum, I tell people start to build in daily planking. I'm a big fan of planks and yoga, Pilates, anything like that. And so, yeah, that's just a great takeaway. I think not enough people do focus on the core, like you said.
And honestly, you don't really spend that much time doing it. If you put 10, 15 minutes in of doing core exercises, that's a good amount of work. So it's worthwhile. Small segments. That's what you really need to do.
And you reap a lot of benefits. Awesome.
Correct.
So what are some of the positives and negatives of endurance sports on one's body? Are there positives? Because we talk a lot about negatives, but Back to muscle mass.
It's hard. There's lots of studies that are out there. I mean, some of the studies are, number one, that, running does not promote arthritis. That we know. So I think that's a good point to be taken, is that just because you're running doesn't mean you're going to get arthritis. I think if you've had an injury to, let's say, your knee or your hip, and it's been something significant, hey, I was 20 years old. I had a meniscus tear and I had an arthroscopy and someone took a piece of meniscus out of my knee. Well, we know that you've taken out some of the shock absorber and, the pressure loading inside of your knee goes up from the normal situation. That knee is going to be at risk for the development of arthritis at some point. So I think if you already have a little bit of a cog in the wheel that's been damaged, you really have to pay, homage to that and pay justice to that and respect that. And my training over the last 15 to 20 years has dramatically changed. I mean, I can't do, although someone says you're crazy, Mark, because you were running, 80 plus miles a week, but it wasn't the same 80 plus miles a week that I probably did 15 years ago. It was slower. It was on softer surfaces.
In what way?
Way back when I was doing an incredible amount of speed work, lots of plyometric work, and the body just can't, I need to recover. That's as aging athletes, you need to recover. And the recovery period is ideal. I mean, it's not so much of a mental recovery. It's a physical and metabolic recovery. Your body adapts to all sorts of stresses and it adapts in a good way. That's why, when people have bone loss with osteoporosis, we implore people to do impact loading activities. That's when, the foot hits the ground and the force that it impacts, goes up to the knee, goes up to the hip, goes up to the back. The body goes, oh, we need to build more bone because we're seeing more stress. That's great. But if you repetitively keep doing that, the body will ultimately break down. So I think to a certain extent, this so-called metabolic, the body understanding that it needs to respond to it, has to take place in a somewhat controlled environment. And, 30 years ago, 20 years ago, I could do this workout, I could do that workout, every 2 times a day, I could beat myself up. And the next day I could get up and feel like, wow, I feel great. Let's go do it again. Now at 59, 60, I wake up the next morning and I go, God, my ankle hurts, my back hurts a little bit. Maybe I take it a little bit easier today and change up my workout. So you have to modify things. And that in turn then is the psychological aspect, which is really difficult. That's the pill that you don't want to swallow that I thought I would never say, about getting a little bit more mature, a little bit older, is that you have to adjust things. But if you can adjust it and continue doing what you're doing, then you're doing a great job.
Right. And you have more maturity and wisdom. That's always a good thing.
100%.
And admitting it. So it's where the ego comes in. Yeah, the ego is what leads to injury as we age. And I want to reiterate, because that was very, very helpful too. I love this. I'm learning a lot from you already. I'm kind of enthralled because it resonates with obviously so many. We're all getting older every day, but the recovery, modifying things and changing it up. Those are a couple of key things that you said. And I know that the recovery part is so critical. So switching gears just a little bit, my background is nutrition. So of course, you know what my perspective is on this, but I want to ask you, as far as recovery and in general, how would you say, what role does nutrition play in supporting healthy bones also as we age? And this comes up a lot. Do you recommend, from your perspective, any specific supplements or foods to preserve bones and joints?
So I'm your worst patient.
Okay.
I could live on brownies and pizza for the rest of my life. And there's a famous, and we'll get into what you asked me, but there's a famous ultra marathoner. Her name is Courtney Dauwalter, who is probably the preeminent ultra marathoner in the world right now. And she always says, and she's won an incredible number of races. And they always ask her about diet. And she's like, look, I want to live life. I want to, eat what I want to eat. And I don't want to think about it. Sure, maybe if I ate a little bit better, maybe I'd be better. But you're already like, okay, you're the top. I don't know how much better you could possibly be. But be that as it may. I mean, from my perspective, when I work out, I fuel to work out and I fuel to recovery. So I'm never in, hopefully, a phase where I need to lose weight. I mean, ultimately, I'm within 3 or 4 pounds of kind of my ideal weight. So just as my volume starts to increase or my weight training increases, I lose those few pounds. But certainly I'm always concerned with, burning calories and then taking in adequate amount of calories back. So you're never really in a caloric deficit. I do carbohydrates. I've been on every crazy diet that's ever been out there just to see what it would do to my training, and never really been enamored because, again, I've fallen in that realm of a lot of people talk about going vegan, and a lot of the ultra marathoners are going to plant-based diets, but I just can't. That's just not me. I just can't do that. But so I try to take in adequate protein. When I'm done with the workout, I try to recover with protein, the 4-to-1 ratio of carbohydrates to protein grams. And then in terms of supplements, I will, in heavy periods of training, I might take a multivitamin, that has vitamin D. Everybody in this world is vitamin D deficient, especially in, the northern hemisphere. But, the minute your urine starts to turn yellow, you're basically peeing out what you're taking in. So you have to be a little careful. And I don't take very high doses of things because they can be somewhat toxic to you. But I try antioxidant fruits and things like that. But I try to just keep a well-balanced diet, But when I break down for a nice, brownie or piece of pizza, it's hard to resist those things.
It is hard to resist. I'm happy to hear you mention the antioxidants from fruit, from whole foods. That's good though. At least you're not popping collagen. And this does come up frequently. People think they have to take all these collagen supplements as we age to protect their joints in particular. And yeah.
No, I mean, I tell you, there are those preparations, glucosamine and chondroitin sulfate pills. And clearly, the American Academy of Orthopedic Surgeons has come out very strongly and says there's no scientific evidence that rebuilds cartilage. And you also have to think to yourself, like medications, okay? So medications that are prescription meds or over-the-counter meds, I mean, these are chemical compounds that go into your body, interact with other molecules, and alter those things or do something to promote healing, reduce fevers, things like that. Thinking about taking the components of collagen and eating it and having hydrochloric acid in your stomach, break that down, and then miraculously it finding its way to your joints, I mean, it makes no common sense whatsoever. Now, the placebo effect is a real thing. So if people come in and say, hey, I took this or I took that and it worked, I say, God bless you, have at it. Spend your money, but there's no science behind it. So I'm very cautious about those types of supplements.
I concur particularly on the glucosamine chondroitin. That comes up a lot. And I say the exact same thing as far as that placebo effect. That is a real thing. Yeah. And so if it's working for you, by all means do it. Yeah. Really interesting, isn't it? But that said, of course, I have to throw in proper hydration and just eating a good, healthy, balanced diet for you, whatever that is. And I agree, particularly at the endurance or ultra marathon level, people just need to make sure they're fueling enough adequately. And that's part of recovery, not under eating. So that's, I want to that point as well. Because
absolutely. I mean, hydration, that's something I've had to learn about through many races, specifically, anything that's over 3 to 4 hours, you lose body water weight. And once you start to lose 1% of your body weight in water, everything starts to shut down, specifically your GI system. I mean, it's not uncommon at any level of endurance race to see someone vomiting on the side of the road. They think they're fueling and all they're fueling is their stomach and it's not going anywhere. And the next thing you know, it's coming up, out of them. So, it's a learning process on how to adequately fuel. Some people can take in 100 calories an hour. Some people can take in 300 calories or 400 calories an hour. And it's all individual. And that's what we often say in a race, don't try something new because it's bound to, backfire on you. And something you got to learn. It takes time.
It does. That is so true. I can speak from that experience. Don't do a fruit smoothie within an hour before a race.
No.
I'll just leave it at that. Oh, too funny. I will say not everybody needs to be obviously an endurance athlete. Like most people are recreational athletes. Regardless of where you are, where one is, meaning you, me, anyone. a lot of people do have to stop exercising due to injury. And so bringing this to you, actually, have you had sports related injuries? What happened? How did you bounce back? How did you rehab yourself?
I had plantar fasciitis for a very, very long time. And so plantar fasciitis is often, I'm sorry?
Sorry, this is a big one for a lot of
Yeah, a
my
lot of people.
clients, and I don't know what to tell them.
Yeah, so this is the bane of runner's existence. So this is your classic heel pain. People describe this as a heel spur. In essence, the plantar fascia is a very tough fibrous lining of the muscles of the underbody of your foot. The fascia is, if you eat meat and you go to a butcher and you see that there's this silvery lining that's on the meat that people will often take off because you can't eat it. You can't, hard to cut through. That's the fascia that holds the muscle on your undersurface of your foot. Think of it as a little bit of a trampoline. Every time you put your heel down and your foot kind of bends a little bit, that plantar fascia, which is attached to the heel bone, to the calcaneus, like a telephone cable plugged into a wall socket, keeps pulling on it. And eventually some of the microscopic fibers start to tear out of the bone. That causes pain. The body doesn't heal it very well. It becomes some scar tissue. And then it's like the burning ember in a fire. So, you might feel okay, but, you sleep all night and you get out of bed. And the first thing out of bed is your heel hurts. And that's the classic sign of plantar fasciitis. Well, anyway, so I had that and I did everything under the sun. I did every alternative treatment from magnets to acupuncture to pulsed ultrasound where they bang your foot with sound waves to a cortisone injection. And I ultimately had surgery on mine because after 2.5 years, when I told a friend of mine, why don't you just cut my foot off and I'll put a prosthetic limb on and I'll enter any race that I want to as a handicapped athlete. No, I don't want to malign anybody, but, I ultimately had surgery. But it took me about 10 or 11 months to get back to the running form that I have today. But it's really hard. It's the acute phase of surgery, of injury, understanding what you have to go through, and really being fairly religious and committed to the recovery process, and understand that maybe unless you're 5 years old, your body takes a defined period of time to heal the tissue. But then the functional aspect where yoga, Pilates, gyrotonics, all of those kind of increased active level of activities really come into play. It takes, a good 3 to 4 months minimum to get better from certain injuries.
Wow. And I think people need to hear that and be realistic with that recovery, because we all tend to get impatient, but 3 to 4 months, it's worth it versus what's the alternative? Typically being out of commission very long term, which nobody wants, and becoming sedentary. So
right. I think we all ignore things for a period of time. Yeah. Unless it's an acute, you fall, you break something, or you twist your ankle. I've had this shoulder pain for months, and it really started to bother me more. And now I can't sleep on my shoulder. And it's interesting for shoulder pain, rotator cuff, things like that. It's not until people lose sleep over it, no pun intended, but they do, that they really kind of say, wow, this is affecting my quality of life. I don't have to reach up high to get a glass out of the cabinet. I can use my other hand. But once I stop sleeping because of it, that really becomes a problem. And then it's really an understanding that if you've had this thing for 6 months, it's not going away with a single time cortisone injection. It's not going away with 3 sessions of physical therapy. It's a process. And it's a process of retraining muscles, stabilizing things, postural stuff, moving your workstation in the right position. There's a lot of components into this that we don't often realize and we just ignore. Right.
The conscious, I want to say, attention to all of those little things is so important. Thank you for mentioning that, beyond, and it is a crisis point. So the whole goal is to prevent it from reaching that, I call it crisis level.
100%.
Yeah. So I hope people listening, if you have those pains and it's been going on for weeks, don't wait more months.
Right. So, and I think the other thing too is you need to go to someone who shares your visions. I had some older partners that would say, if it hurts, don't do it. For most people, if I said, as the runners come in, don't run, the last thing they're going to do, they're going to walk out of my office and go, that guy was an idiot. He told me not to run. So there's got to be alternatives, for people to do to get them kind of on the program that you will get back to running, but you need to do these steps to get there.
Absolutely. So that's it. Tying this back, you've mentioned sleep a couple times. I touched on nutrition. And, in general, I talk about all these 4 pillars of wellness and our daily habits, and it all comes into play, of course. So I want to ask you, again, as a busy surgeon and endurance athlete, how do you prioritize and what are your daily, call them self-care habits?
I've tried to take up some meditation, to calm the average beast. But I would say that running is my meditation. When I'm on a run, often by myself, I think I had a teacher back in high school who was a Taoist, and he would always talk about nirvana and running some of these ultra endurance races, and even running a 6-mile run or a 5-mile run. There's a moment in time when it's almost time. I find that it's timeless and that I lose myself in my thoughts. And to me, that's my meditation and that's my peaceful time. So, and whether that's endorphins that are flowing because I've generated a good sweat, for me, exercise is my therapy to a certain extent. Obviously, I try and sleep as well as possible because, both from a psychological standpoint, but from a hormonal standpoint, that's when growth hormone, cortisol levels all really normalize is when you sleep. And when you're sleep deprived, there's clear studies out there that say your cortisol levels rise, your stress hormones rise, and that creates a setup for injury. So the one point that I will always make is that if you don't feel like working out on one day, then don't work out. People get in programs for marathons, blah, blah, triathlons, and they go, I've got to do this workout. I've got to do my Tuesday workout. If you miss one workout in the grand scheme of your life, it's nothing, so you have to listen to your brain sometimes. But I mean, for me, again, like I would say, running for me or biking is really my therapy more so than anything.
It's so true that you do have to listen to your body. I love hearing that. Do you do something every day? Do you make time?
I would say that I pretty much do something every single day. And whether it's a hard workout or it's, I sit on my indoor trainer bike and just spin for a half an hour, 45 minutes, I just do something.
Yeah, that's really what I love to hear and so important because I preach that. And the human body is meant to move daily. And I love that idea of the running for you. And I can completely relate that it's kind of a meditative thing, but it's a really awesome form of stress relief. And I talk about, how we all need to manage stress. We all do. So it touches on everything you're getting. It's good for your mind. It's good for your body, fresh air, being outside. And then, of course, that does help you sleep better. And then when you sleep and you sleep well, then you do have the energy and you're more likely to continue to exercise. But if you're not up for it one day, or, I'm the same. So I say to people too, that in the past, it's been a while when I did just a couple sprint tries and I had young kids. The only reason I was able to do them is because my very young baby was a good sleeper. And therefore I was able to sleep. So it depends on where you are in your life and just listening to your body. I think that's my favorite takeaway for people is honor where you are on that given day and don't push yourself. But that said, if you can do something every day, you reap all those mental and physical benefits.
Correct.
I'm still going to get you to probably think about adding more antioxidants to your diet. Not that your brownies and pizza aren't good, but yeah, I'd love to touch on all 4 pillars: the sleep, the exercise, the nutrition clearly is a key component too. So, this is fabulous. I think I keep talking to you all evening. There's so much information, honestly, and little things that you've said to think about for pretty much everybody, whether you're preventing injury, whether you're an exercise or endurance athlete, just a recreational athlete. So thank you. There's been so much that you've said that I know will resonate with everybody. So I have one final question that I want to ask you tonight, Mark, that I ask of all my guests. Okay. That is, what's one thing that you're grateful for today?
I'll give you an aside. When we were training it was the Zion 100, I have a group we actually had 9 people running that race. And on every race.
In Zion?
I'm sorry?
In Zion National Park?
Yeah, in Zion National Park, yeah. So during the training, every person on pretty much every long weekend run, we would say what we were grateful for. And it couldn't be, oh, I'm grateful to be with you guys. But it was really, there was an emotional component to all of us running as a group and saying things. So today, what am I grateful for? I'm grateful for my family because they support me in everything that I've ever done. My wife, my kids, they're the most important thing to me. I'm grateful for that.
I love hearing that. And this is for listeners. We're recording this shortly before Thanksgiving. And so it's very appropriate. And I'm thankful for this opportunity and very grateful to be doing this and sharing all of this health and wellness information with everybody. So yeah, this was fun. Thank you.
Oh, it was great. Thank you.
All right. Maybe I'll see you out in the woods trail running someday, Mark.
That would be great.
It would be. All right. Thanks again.
Thank you.
Thank you for taking the time to join me and listen to this episode. Listeners can find more information and also subscribe to the Sense of Wellness podcast at www.ccphp.net/SENS/podcast. That's www.ccphp.net/SENS/podcast. This show is brought to you by Castle Connolly Private Health Partners. We are a concierge medicine organization that partners with exceptional physicians to deliver an unrivaled healthcare experience while also empowering our members to achieve their optimal well-being. Be sure to listen in next time to the Sense of Wellness podcast, and remember, simple daily habits matter most.